It is a concern. So the person had an infection in March, recovered, had a second infection 4 months later. Luckily, it was asymptomatic. I think that's really good news. And when we look in the blood samples of that particular patient, he didn't have a very good immune response the first time round. The second time, the immune response was better. So I guess he may have a low chance or may not be able to get infected again in the near future. But I guess there will be many other cases of reinfections in the coming months.
How many more cases of reinfection? That's the concern. Is this going to be widespread, perhaps as widespread as the virus is today, or do you think this is an isolated case at best?
So when we look at immune responses after infection, some people have good responses, some people have weaker responses. This particular patient had a weak response the first time round. So there are other people in the same situation. Maybe there will be other people reinfected, but it wouldn't be everybody who's been infected the first time around. Some people will really be protected after their first infection.
You say that summer 2021 is when we'll likely see a vaccine. Nothing sooner than that?
Well, we've seen Russia's already starting to use a vaccine in their population. I think some other countries are going to rush to start using vaccines before they're fully tested. I don't think that's a good idea. I think it will be the summer of next year by the time we have some vaccines becoming widely used in many different parts of the world. And those vaccines have been confirmed that they really do work very well.
There's been much hype around in the last few days about the use of convalescent plasma in treatments. Can you unpack that for us a little bit?
Yes, it goes back a long way, 100 years or more. So the idea is you find a person who's already recovered from the infection, you get their blood, maybe their plasma, and then you give it to a patient who's currently quite sick. And whatever was in the blood of the person who recovered could then be used to help the sick patient. It doesn't always work. It seems like it might work for COVID-19, but the results that were presented a few days ago by the FDA were not very convincing. So I would say we still need more compelling data, more convincing data to show that convalescent plasma does work. Nevertheless, it is being used, but it's not that easy. You need a lot of recovered patients just to treat one sick case. It's not a treatment that would be available for everybody.
So more data, more research needed into that field. Professor, what about the Russian vaccine? There was a lot of hype around this when we first heard news that Russia had developed some kind of a breakthrough here, but they've received really a chilling reception from the international medical community. What are people saying now about the efficacy, the viability, the safety of the Russian vaccine?
So the Russians are using a two-dose strategy. They have actually two different vaccines. One is based on a particular seasonal common cold virus, modified to look like COVID-19. The second dose is a similar idea, but with a different virus. And so the idea is you boost people with these two different vaccines, and hopefully at the end, they will have some protection. The data on the effectiveness of this vaccine have not been published. So it's maybe a high risk strategy for Russia to go ahead using it widely. If the vaccine works, good for them. But if the vaccine doesn't really work, they've put a lot of time and effort into this, and it's going to damage not only public health in Russia, but also in other parts of the world, because it will damage confidence in vaccines.